Hey, welcome to That Sounds Gay. I'm in. I'm Matt, and today we have Rachel McDaniel with us, and we are going to be talking about gender affirming care.
Yes, we are. I'm so excited to get started.
Rachel, thank you for coming and joining with us. So I appreciate you having us. So today we're going to be talking about how you can acquire gender affirming care. And can you tell us your qualifications? And thank you again for just joining us and just bridging the subject with us.
Of course. So qualifications wise, I started my practice in Kansas and I have built it over the last almost 9 years. And not too long ago, I got my LSCSW, which is a licensed specialist clinical social worker. And that allows me to practice psychotherapy independently in Kansas. I'm also licensed in Missouri and Oklahoma because rural queer mental health is my thing. And in those states, I'm a licensed clinical social worker. But then I also have a background in Wpath training, which is the World Professional Association on Transgender Health. And I'm also a somatic experiencing practitioner. So someone who focuses on body trauma, which comes up in our community.
Oh, it definitely does. Thank you for getting all of those qualifications because, just not just going to school and then just, going to practice, but just getting those extra qualifications, those really matter, especially when it comes to our community. So thank you for all that you do. I appreciate that.
I'm happy to.
So let's get into it. So we're gonna, walk through the general process of obtaining gender affirming care today. What are the first steps? So when somebody comes to me at the foundation and saying, "Hey, I want gender affirming care," or somebody comes to you in your practice and says, "I want gender affirming care," what is the first step that you would advise them to do? Or I would advise, I guess, you're in a therapy session with them. If I was, with somebody, I would actually advise them to get into a therapy session would be my first step in the process. I would actually advise them to get a therapist to help them with the process.
Yeah.
But if
Definitely
they're
part of
already,
it.
that's I guess my first step. And here I guess I asked you the question, but you know, but that's my first step is to find a therapist because it's such a process. You need a guiding hand
Mhm.
for that. Would you say that would be kind of like you
Yeah, that
know,
would be a great first step because, often there's a series of tasks leading up to, if you end up wanting surgery, you're often on hormones for a bit. You're dealing with a multidisciplinary amount of care. And so it's going to be really good to have somebody who can guide you, and even better, if they're a social worker because, we love networking with the community.
yeah, definitely. I think that one of the cool things about the trans community that we get to do is we get to explore who we are. We get to explore
Mhm.
our identities. We get to explore who we are ourselves. And when we do that within in therapy, it's like we get to really find ourselves.
Oh my
And
goodness, yeah.
I think that that's just absolutely a great thing that trans people do, and I just feel that it's kind of a superpower. Not that you can't do that as a cis person, which you should,
Oh yeah.
but as a trans person, it's definitely a superpower. So let's say that for the sake of the episode, that this person that is obtaining gender affirming care is going to go through a full set of steps. And we're going to go through hormone therapy and a full list of surgeries. And we're not going to gender them. And so we can talk about all kinds of surgeries today. But so we have a therapist to help us because we have a lot of steps. And one of the steps in obtaining some surgeries is a certain length of therapies. Starting out with a therapist right away will give you that length of therapy. I believe the general surgery requires how many months of surgery and some insurances. Now, every insurance is different, and I advise you to check with your insurance company. And some surgeons do have their own requirements, but I believe if you're undergoing genital surgery for the policy that I have right here is Blue Cross Blue Shield, and the one I went under was Medicare Medicaid. So it was a Medicaid surgery. I didn't do the genital surgery, but I did do all of the policies up to it to see if I was going to do it, and then I just stopped and didn't do it. So I do know the policies, but they both Blue Cross Blue Shield and Medicaid require 12 months, I believe. That's what I'm seeing.
Something around there, I want to say. And I'm usually not the one who is keeping track of that time. Usually it's the person who wants to go and get surgery who's keeping track of, okay, I started hormones on this date. I started working with a therapist on this date. And then they start to get the time under their belt that they need to finally move forward with the next steps.
So it's definitely something that you want to start with. What other types of professionals are typically involved with gender affirming care?
So it could even be somebody like your primary care doctor. I know that there are family practitioners who sometimes do this. I know that Planned Parenthood has been a resource for people before. Clinics where there is a certain amount of extra study on sexual health, because when we're dealing with sexual organs and secondary sex characteristics, we want somebody who's spent a little bit more time on all that.
Yeah, and there's definitely specialized clinics, and so, reaching out to people that can guide you to those certain kind of clinics are always helpful. And even doing a internet search for a transgender clinic can even maybe guide you to some specialty clinics to see who specializes in gender affirming care. And you can even put in gender affirming care into that.
Even better if they're Wpath certified, because that is World Professional Association on Transgender Health. And if they are certified with them, that would definitely be the place to start.
We will definitely put that our notes for at the bottom for here, so you can see that, and so you don't have to remember that here.
Mm-hmm.
And so you can, reference that back at the end of this. So, Rachel, when you're doing the mental health assessments and evaluations for somebody that's going through, is there any certain assessments or evaluations that you do on somebody that's looking for a gender affirming care?
Oh, yeah. And what I end up doing is often the kind of initial workup I do on every new client, which is, we're going to start with what's called a biopsychosocial. And that's where we're going to kind of just go through all the parts of your life and see how you're doing with them, get a good idea of what's going well, what you need a little support with. And then from there, I do what's called a mental status exam. And that's just kind of a pretty brief exam that just checks and makes sure that all the parts of your brain are working well. You know what day it is, you know who the president is, you can follow patterns, you can recognize pictures of animals and things like that. And then I do symptom scales for mental health disorders. And I kind of just routinely check for things like anxiety, depression, stress, trauma, dissociation, OCD, just as these things get talked about on the internet, especially, I want to make sure we're starting off with a very thorough, just broad look at, hey, this is your mental health.
Wow. That's so cool that you just, you get a full scale of, you're not just taking care of the person for gender affirming care, but you're taking care of the person as a whole and getting a full map of the person. And I think that's absolutely wonderful that it's not just one-sided care, it's a full body workup. And I think That's really cool. So, one of the things that we have to talk about the fact that trans people and gender affirming care is talked about in the media, and so one of the things that we hear about is consent. So, can you explain how informed consent has shaped the process and how it impacts the patient's experience?
So kind of part of our initial like consents and everything is a really clear description of what therapy is. And therapy is as deep and as intense as you want it to be. Because unfortunately, I am not a mind reader, but we want to make sure that what is happening is in line with what the client wants. And so we're just going to kind of always be checking in about, okay, how do you feel about, this thing that is a part of your care? Okay, if you don't like it, like, is there a way that we can modify it where it feels a little more authentic to you? Is there a way where we can have a conversation? Because, I think consent is definitely a topic that the general population as a whole could benefit from.
I think that's great. I am a firm believer of consent is something that needs to be used in a lot more areas of our life.
Takes a
For
lot of
those that are
humility
facing,
from the
yeah,
practitioner because, when I'm in the room, I'm the expert. And so of course, it's really easy for me to be on a pedestal. But, I think good providers come down and do not try to stay on that pedestal and are willing to collaborate on your.
yeah, definitely. I agree with that. Yeah, collaboration is so important. And I think that that's, when I think about my therapist, I've had my therapist for 7 years now, and it doesn't feel like a power struggle. It feels like a collaboration. I wouldn't go as far as a friendship. It's definitely the collaboration would be the word. I feel like we have a working relationship and we go in there and, we're working on me, and it's a collaboration of two people working on working on me. I think collaboration is a very good word. Um, so for those that face barriers like insurance, what do you have advice for them for finding support?
So I would definitely encourage people to talk to their insurance company and see what their policy covers. Because it's amazing to me how often, for example, somebody's going to go pick up hormones from the pharmacy and they'll initially be told that they don't have coverage for it. But then when they end up calling their insurance company, sometimes they find that there is actually coverage for it, which makes it affordable. Because, there's this kind of standard in insurance where a good number of the claims that come in get denied and haven't really been thoroughly looked at. And so, kind of getting that second confirmation that, like, yes, this is exactly what your coverage is or isn't.
Yeah, I know. I was on hormones for a year, paying out of pocket until I got to the time to redo my insurance, and I was looking through it, and it says it covered testosterone. And I called my pharmacy, and I said, "Hey, my insurance covers this," and filed a complaint. And then all of a sudden, it was covered, and I had been paying for it out of pocket because they said it wasn't. Um, it
People at
was
thousands.
yeah, and so it was, definitely check into that. And then I fought for some of my surgeries, and so definitely check for that. I would also say that there are some simple jobs. I wouldn't say simple. There are not simple jobs. That's the wrong word.
Right,
I
right.
apologize. There are some jobs that are easier to get and that are always needing people,
Mm-hmm.
and you just have to look,
Mm-hmm.
and their insurance
Oh, yeah.
covers and
And some of them
covers.
use it to recruit too, because,
Yes, and yeah, absolutely. And there's different abilities, health abilities.
yes.
So if you're somebody that is more into lifting things, there's lifting jobs. If you're more fast paced, there's fast paced jobs. If you're more of an
Oh,
office
pulling
person, there's
those.
office jobs. And and these are jobs around the country. And if you're in a rural town, there's jobs that are gas station jobs that do cover insurance. And so it may just be a changing employment and for the time of needing what you need.
Benefits and compensation are a big part of people, changing jobs, throughout many industries.
Yeah, I had a buddy that until he had his surgeries, he went to a distributing company for a mailing company that paid for his surgeries. And, he went there for a few years and now he's back bartending. And, he used his benefits. So, research is a powerful tool.
And if it's important to you, find the ways that you can make it happen because, it's going to take a certain amount of you pushing for things to end up happening.
Yeah, absolutely. And things don't happen overnight. Transitioning is a journey. It's not, I think it took me 7 years to transition to where I felt happy. But you have to remember that puberty lasts, when you start out as a 12-year-old boy with a squeaky voice, you're not happy with yourself.
No, not at all.
With your pimples and your awkwardness and you can't talk to girls and your long arms and your sweatiness and you stink and it takes years before, and your patchy beard and, it takes years before you look and you feel right, through those teen years. And that's true for transitioning too.
Yeah, and it takes years to learn how to do these, kind of everyday tasks that go with hygiene and self-care because everyone has their own unique formula for all that stuff. And so it's also going to take you a bit to find your style, to find how you prefer your hair, your face, like all of it.
Yeah, absolutely. And so we have to remember that, so that's what I did when I was transitioning. I was like, I'm a 12-year-old, I'm a 13-year-old, I'm a 14-year-old,
I have to call it second puberty because it really does feel like it.
It really is. Even if you're not on hormones yet, it took me a year before I got on hormones. I was still, a kid, I was a 10-year-old then, and then I was 11, And so, it's a
just
process.
For clarity, like you started your transition as a full-grown adult, but you're framing it more like this because
I was
you.
35. Yeah, I was 35 years old, and I just remembered that I was a kid, and then I went through my angry phase, and because I had to, because I was going through all of that as an adult, and I was like, well, 13-year-old boys are angry. And, and then I went through a phase where I had to have my hair green and I was like, I'm teenagers. And there was times where I had to have 1 million stuffed animals on the front end of my car. Okay, well, that's teenage. And so, that's something that is part of the process of transitioning as well, even as an adult, is that we have to have, that part of our childhood back as well, because we didn't have that childhood.
Yeah. And we might have been blocked from, doing the things that felt right to us. I love fashion coming back around again because there were so many trends I wanted to try to play with. And now that I'm older and I get to make my own choices, like you get to try on all of those pieces of growing up that you may have wanted to try on before.
Right. And so we have to, remember that it is definitely, a journey. you've ever had chickenpox, the virus may still be hiding in your body, waiting to reactivate as shingles. Shingles is a painful rash that can cause long-lasting nerve pain, and the risk increases as you age. But there's a way to protect yourself: the shingles vaccine. This safe and effective vaccine dramatically lowers your chance of getting shingles or experiencing severe complications like post-herpetic neuralgia. Don't wait for shingles to disrupt your life. Take control of your health. Ask your doctor about shingles vaccine today. A simple shot can prevent pain and help you enjoy life worry-free. So now that we start talking about, that first step of getting into therapy and figuring out who we are, can we talk a little bit about the different types of gender affirming care that's available, such as hormone therapy, surgeries, voice therapy?
Yeah.
Some of the options that, are available out there. So there's, and when we're talking about gender affirming care, I do want to put out there that this is not just a queer thing. You can get gender affirming care as a cis heterosexual person. Gender affirming care is not a queer thing.
I office at a women's collective, and many of the women, well, not many, but like some of the women are going through menopause and maybe getting on estrogen to kind of support their bodies as their ovaries aren't producing the same amount of estrogen. And so, it's amazing the ways that gender affirming care crosses all of these boundaries. People who take extra testosterone, or, who, want a jawline that is perceived as more masculine, or, they don't enjoy the male pattern baldness. And so they end up with gender affirming care that allows them to feel whatever they are, whoever they are.
Yeah, it's making you feel more affirmed in your gender. If you just switch around those words, you see that it's not a queer thing. It's not a trans thing. It's a human thing. And I think that's one of the things that I like to talk about in my classes and in the podcast is a lot of things that we're talking about. It's not a queer thing. It's a human thing. And so, when we're talking about hormone therapy, that there's a lot of cisgendered men and women that are on hormone replacement therapy, after menopause or hysterectomies, and men whose testosterone is low. So this is not just a trans people. And when you have surgeries, when I went and had my top surgery, a lot of the nurses, and I asked, because I'm brass, for those who don't know me, I asked the nurse when I went in to get my top surgery. Here I'm getting, to get rid of, my chest. And so I asked the nurse, I said, I have to say, every nurse has great breasts. Did the doctor do all of the nurses? And she said, yes, because it advertises for the doctor. He did it for free. And all of that is gender affirming care.
Oh, yeah. I knew people growing up who never developed very prominent breasts and felt really, detached from their femininity as a result. And so went and got breast augmentation. And you know what? If that's what makes you feel okay in your skin, I'm not here to poo-poo that.
Right. And so, and my double mastectomy reconstruction surgery is what top surgery is technically called, is very similar, but not the same as a double mastectomy for cancer or cancer prevention. And so I've had women reach out to me who've got diagnosed with or got found with the gene and had the top surgery. Yeah. And so they've reached out to me for aftercare instructions and stuff like that. And it's very
the aftercare.
Interesting that we've shared that bond. They've asked me about pain and things like that.
Yeah.
So, and even, voice therapy, I've considered voice therapy because I have a higher voice, but I've done call center, and you can't tell if you're talking to a male or female over the phone.
Not really.
And you should never judge. You should never say ma'am or sir over the phone. That is very, very wrong.
Before honorifics.
Yeah. And that's something that I educate, because the tone of, somebody's high or low has to do with their vocal cords. Doesn't have to do with, and my voice is higher because I started testosterone so much later. My son, who is a trans man, started testosterone 22. And he sounds like, he can sing bass. And I'm really offended. And I told him that the last phone call. I was like, who am I talking to? He's been on testosterone for a year now. And I'm like, who are you? And I love it for him. And he's like, well, Dad, I don't know how it happened, but this is, and it just depends, but you can't tell. But you can do voice therapy. And I have a friend that just started voice therapy, and it's just like one session and it's just been amazing. And I'm like, well, maybe, but I'm one of those people that I don't prescribe to sets for what a male or female should. So I'm not changing my voice, but some people, that's really important because they do work on the phone. And so that's important because I know whenever I'm on the phone, I get called ma'am every time. And I always say my name is Matthew. And I always even deepen my voice and I still get called ma'am. And so I can see where that bugs people. So voice therapy is so important.
And there's some people who get incredibly dysphoric as soon as they speak. And, if you're dysphoric when you're starting to speak, you might speak less. And that's not something I want for anyone.
Right. And so voice therapy is very important and accessible. And there's people out there that can, and I've heard great things. So it's not just hormone therapy and surgery. There's a vast array of things out there for
and not everybody wants
gender
surgery.
affirming care.
So they can bind if they want to bind, or they can, pack if they want to pack.
Right. I've had people, reach out to me, what do you pack with? And my advice for packing is that people don't pay attention. And so if you want to pack, it has its ups and its downs. If it's important to you, there's a wide array of things that you can do. And so, go for it.
Similar with binding, you want to get professionally
get a binder
supported.
There's rules with binding. Please follow the rules.
Yeah.
I'm an asthmatic. I had a very large chest. And so those two things didn't go well for me. So I was unable to bind. And so, I was unable to wear a binder. I had a binder, and I couldn't use it.
Yeah.
So safety is important.
And if that tension is painful or uncomfortable for people, like there's gradations of it too. Like some people just use like a sports bra because
that's what I did. As I wore two sports bras and it just contained, and I lived with a girlfriend who had two little girls that never knew that I was assigned female at birth, just because big men have breasts.
Yeah.
And so, and they even asked, because they my bra fell out of my clothes when I was walking through the living room once. And the little girl that was 6 years old said, Mom, why does Matt wear a bra? And Mom says, don't worry about it. Sometimes big men wear bras. And, it was just, and because, so they never questioned. And
yeah, there's ways to be kind about that too.
Yeah. And, you just learn to be kind. And so just be careful when it comes to binding, because there are rules, and,
follow directions, make sure
follow
it's
directions.
Right.
Don't sleep in it. Don't wear it more than 8 hours. Those kind of things.
Yeah.
So the next thing I want to ask is,
also, just if you don't mind, just a moment too, like there's also other ways to, alter your hormones a little bit too that don't involve medications. When we eat soy products, there's of course cautions with soy, but soy has estrogen in it and can kind of help you with more of that, raise an estrogen if you want. And then if you're wanting to increase testosterone, exercise is really good for increasing testosterone.
Yeah, I lift weights. So, it's, and so that's just one of the things that, helps.
And good for your mental health too, because helps you burn off stress.
that's what I do for my stress relief is when I'm stressed, I go to the gym and I lift weights. I may not, you see me out here with a cane. I may not be able to walk well because I have bad knees, but I do go and lift weights. So that is my stress relief. So that is good advice, Rachel. I appreciate that. So the next thing I want to ask is, do you know how long it takes, usually to get gender affirming care? I did look this up if you don't know.
I don't know off the top of my head.
So I looked and it takes, so in the UK, it takes about 2 to 4 years. In the United States, it takes about 4 years before people usually get gender affirming care. And
Yeah,
so that doesn't surprise me just with, the way the insurance usually runs.
and finding a good provider and, them
Yes,
having time to see you too, because, we
right.
definitely need more healthcare providers.
I think my part was the fact that I'm in rural Kansas. I was in rural Kansas at the time, and access in Kansas has gotten so much better because, like, I know where you are, you're a provider, but when I was looking for somebody in your area, there was so few people in your area at the time that I was living in your area looking for somebody that could see me and that took my insurance. It was like, so when I was trying to get my letter to get on hormones, I was paying so much out of pocket because there was just nobody that took my insurance that would see me for gender affirming care. And that was 8 years ago. And now it's so much better. But I was like I was calling around saying, would you see me for gender affirming care? And I would get somebody to say yes. And then I'd go and meet them. And then I'd meet a therapist that would say, well, I have a gay nephew and I'm so interested about trans people. And I'm like, no, thank you.
There's still more training than that.
And I'm like, I'm not going to be your training.
Well, and who wants to educate their therapist on what they need to know to work with them? Like, I don't want to pay you to teach you.
Yeah. And so now there's so many more trained therapists out there and in our rural area that it's easier and easier access. But there's still so much rural area in the United States that but there's online access.
Yes. Which is part of why I license in states I don't live in that are rural and have a hard time finding anybody that does this kind of care. Because if all we can do is beat by video or phone, and this is how we form the therapeutic relationship, great. That is evidence-based. We still see good outcomes from telehealth.
That I agree because when I started meeting my therapist, years ago, I mean, I was next to her, but now I'm like 4 or 5 hours away from her. So it has to be telehealth. And if I'm ever in her area, I see her in person, but it's
prefer in person.
Yeah, I prefer in person too. But, I also prefer my therapist.
Reality.
So, I have to, do online. Well, yeah, I mean, so this last little bit that we have here, I just want to kind of go over just kind of the guidelines that insurance might have for some, gender affirming care and just some regular guidelines that are current right now that they have.
Yeah.
So when we're talking about the bilateral mastectomy, which is usually the female to male surgery to the top surgery, is what is, called.
Yeah.
So some of the requirements go ahead.
There's also chest reconstruction because sometimes after the double mastectomy, people want a more masculine look. And so they will go in for an additional, or depending on the surgeon, they might be able to do some of that while they're in there. And then there's also people who are transitioning from masculine to feminine and, they, for whatever reason, genetics, who knows, experience not enough breast tissue development and might want to augment their breast.
Right. And so the things that the Blue Cross Blue Shield is what we have. Yes, the policy we have.
And they're kind enough to email those out.
I appreciate that. So you have to be 18 and, you have to be fully informed. So they make sure of that, which is usually done by the surgeon. You have to be diagnosed with gender dysphoria. And So will you explain that diagnosis of gender dysphoria, why you have to be diagnosed with that?
Of course. So gender dysphoria is the actual diagnosis of that basically says, hey, you're trans. Because I mean, the foundations of this diagnosis is feeling like you align more with the other gender and all of the discomfort that comes from, hey, I'm a man trapped in a woman's body. That is uncomfortable because when we are at war with our body, we are at war with our fundamental, like, emotional resource. So, it does create emotional discomfort, physical discomfort, and I don't know. What else would you like to know diagnosis wise? Like, how do
Yeah,
I whip
no,
out my book?
I like that because, because you have to be diagnosed with gender dysphoria
Uh-huh.
to get any surgery.
Mhm.
And, so I just appreciate that.
Mhm.
And because it's just, and then it says that you have to live with all of the following,
Mhm.
which, it's the desire to live as the opposite sex, which, I mean,
Mhm.
if you're going through this, you usually
Yep.
have that
Love that you
desire.
have the list. It's in my
Yeah.
book over there somewhere.
They want you to present as the identity for at least 2 years,
Mhm.
and that this disorder is not a symptom of a mental disorder.
Mhm. Which is part of
You
all
know,
that screening and rule
there's
out.
all of that screening that you go through, and that this disorder does not cause clinically significant distress or impairment in a social occupation. Okay, so and then this next thing that I really want to talk about here before we end this, and then we'll pick up more on another time here. But this next thing that is required, and when you look at your insurance information, it says that you cannot have significant medical or mental health issues present to have this surgery. And some of these diagnoses in here are like DID, borderline personality disorder, bipolar, psychotic episodes. So will you explain this a little bit? Because I don't want somebody to see their diagnosis in here and just get completely discouraged and completely give up.
Yeah. So it's not that we want you to have no mental illness whatsoever if you're ever going to transition. It's we want your mental illness to be well managed. Because, what, if you're going through these surgeries, a surgery is still a pretty major thing and it's going to impact your body. There's going to be aftercare. And, let's say you have depression and it's hard for you to get out of bed and it's hard for you to do your daily activities, your hygiene, you might get sick. And we really don't want that to happen because we want this to work well for the people who get the surgery. And if you're too mentally ill to take care of yourself, this is a sign to us like, okay, let's get that under control first so that you can be healthy enough to have a good experience with surgery.
See, and I think that's important. And I don't want people to see that and think, my goodness, because you have to be healthy for
Mhm.
all surgeries. Like when I had
Yeah.
my gallbladder out, I was, 330 pounds. And he said, anybody over 300 pounds, it just doesn't work well. And so he said, try to get to 300 pounds. He gave me a diet. It was a horrible diet that he put me on. And I lost like 20 pounds. I didn't lose the 30 pounds. Still gave me the surgery because I needed it. I was in pain. I was still high risk, but I was not as high risk as I was at 330 because I was
Mhm.
310. And I did have some complications, but not as much as I would have at 330. And, we worked through it. But I mean, I had to get healthier before I could
Yeah.
have a surgery that was causing me pain. So he left me in
Mhm.
pain
Yeah.
to get healthier, to have the surgery that I needed. So, I mean, he didn't want to leave me in pain, but he needed to
Mhm.
get me healthy enough so I didn't get really sick. And so, I mean, that goes for transitioning to or gender affirming
Yeah.
care as well.
Oh, yeah.
So, Rachel, I appreciate your time today. I would love for you to come back to talk about more surgeries. We just ran out of time today. So, if you could come back another time so we can finish up and talk about more, I would really, really appreciate that.
I would love to. Talking with you is always so easy and fun.
Well, you are always such a pleasure. But we ran out of time today. But we're going to have another episode just right after this one that has more surgeries and a lot more information. And we'll have Rachel right back. And so I appreciate you, Rachel. That's all for That Sounds Gay. I'm In. And Rachel, again, thank you so much for your time.
Thank you.